The Aphasia Communication Group meets every Wednesday from 3 p.m. to 3:50. That address is 2750 East Beltline Northeast, and we meet in the lower level in the conference rooms. So we meet in 6-week increments with 2 weeks off between each session. The benefits of working with the group is that you can practice talking and understanding, reading and writing within that group setting and have that support system with other people who are going through the same thing as you are. We do a lot of communication partner training, teaching people how to effectively communicate in ways that are not just helpful for the person with aphasia, but also for the communicator. If you're listening to the person with aphasia, you want to make sure you're giving them enough time. So it might take them longer to get their words out. Giving yes or no questions is a lot easier to respond to than an open-ended question. Some other things that we'll try to do is teach them different compensation skills for word finding. We might give them different strategies or different augmentative communication devices if they can't get their words out. We'll do something called melodic intonation therapy, using other parts of our brain to help our language center. So we create a melody out of the speech that she's trying to say with some of the scripted phrases, so you can use the right side of your brain, and that helps carry some of the load for the left side of the brain. So a caregiver can help the person with aphasia without talking over them or making them feel like they can't talk for themselves, by making sure they have enough time and they're being really patient with the person who has aphasia, giving them a lot of time to respond. Answering closed-ended questions is a lot easier than open-ended questions, and supporting their language by giving them opportunities to respond and letting them try first is a lot easier or a lot more beneficial for the person with aphasia than just assuming you know what they're going to say. Sometimes you might think they're going to say one thing and that's not what they actually wanted to say. So it's good to let them try a few times and then ask them, do you want me to help in this situation? And then they can say yes or no. Or you can ask, do you want choices? And give them a few multiple choice answers. If you think it might be one or the other things, then you can also give them a couple different options of scenarios, like if you wanted to go somewhere, do you want to go to this restaurant or that restaurant? So you can give them a few different options that way, and they can choose for themselves.